Hi everybody, I'm Cynthia Anderson. I'm a physician here in Florida, and I wanted to talk a little bit about the information that we think is going to come out in the next day or so about using masks as we try to decrease the spread and transmission of coronavirus during our pandemic. I know there's a lot of confusion about the masks and why now, why the recommendation changing now, what kind of masks should I be wearing, where can I get a mask, how can I make sure that if I get masks, I'm not going to make it harder for someone who's a first responder to get a mask. These are all really common questions that people are having, and I wanted to take a second to try to help give some answers and maybe help give some guidance to you so that you can be part of the solution and not create a problem. So first of all, why are the recommendations changing? Well, we had some initial data collected by the British Medical Journal that suggested the possibility of wearing masks making things worse for the general public. There were some collected data that looked at some studies of people who wore masks during infectious seasons like cold season, flu season, and whether or not these masks could really make a difference. And the initial data suggested that the daily wearing of masks by people in the public could make things worse because the masks were getting dirty and people were putting grimy masks that were collecting germs and breeding grounds and then breeding that in themselves and then increasing the likelihood that they were getting sick. The other concern was that if everybody starts wearing a mask, then healthcare workers and people on the front lines are going to run out of something that's already in short supply. So for those two reasons, that's part of why we held off on making recommendations for people to start wearing masks. So what caused the change? Well, we're obviously in a pandemic right now, and the number one thing that's going to help us get out of it is to decrease the spread of coronavirus. So the question was, could wearing a mask decrease the spread? And when we looked at some of the early data that's now coming out of Asia, there are suggestions that people who wore masks during the SARS epidemic and people who wore masks during the COVID epidemic may have helped contribute to decreasing transmission and spread of the virus. So we don't know for sure yet if the recommendations are going to change, but those are some of the reasons why we're thinking about it. And it's going to be important for us to see what comes out of the CDC and the government. So now I want to talk a little bit about masks and how you can think about what mask is right for you. So I really think about masks in three categories. One is what we call the N95 mask. One is a surgical mask, and a third mask is a cloth mask. And really the mask that we're looking at for the public, in my opinion, is the cloth mask. So first let me show you the N95 mask. So these masks are so valuable right now and in such short supply that I actually keep mine in a Tupperware container to keep it clean. My hands are clean right now as I'm going to touch it. These masks are reusable. When I was on the infection unit in my training hospital, we would wear these masks and keep them as we went from patient to patient throughout the day, and we could even use them for several days as long as they stayed clean and they made a good seal on our face. These are fit. They come in sizes to help make that seal. So when we get fitted for these masks, we make sure that we get the one that fits our face appropriately so that we have a complete seal and we can't feel any air going in and out. These are not the masks that we're asking the public to wear. These are really meant to be reserved for the people who are on the front lines. The next mask is the surgical mask. You're used to seeing these on the faces of surgeons and people who are in the operating room. These are disposable paper masks. The point of these masks really speak to what all these masks are about in general. People think that wearing masks is about decreasing the likelihood that I could get something from you. But actually the biggest point of masks is decreasing the chance that I could give something to you. So we're actually trying to prevent my ability to give something to somebody else. And that's becoming important with SARS and with Corona because part of the problem is people are asymptomatic for the first few days and they don't realize that they could be spreading it to somebody else. So by wearing a mask, they're decreasing the chance that they could give it to somebody else. Again, surgical masks are not easy to come by, and so these are not necessarily the biggest ones that we're looking for the public to use. So that's going to bring us to the third one, which is the cloth mask. And this is an example of a cloth mask that was made for me by a friend, and they are really wonderful. There are sewing circles everywhere that are going out and making these. There are tons of videos on how to make them. And certainly if you know how to sew and you are a seamstress or a sewer, then go for it. If you want to make one of these masks, you can. But really the unsung hero are going to be the cloth masks that you have access to in your house right now. Lots of people have scarves and bandanas and t-shirts, clothes that they could use to help make a cloth mask. So just a simple bandana put around your face could help provide the barrier that you need. As you can see, it's covering down here on my whole face, and this tied around could be sufficient. If people want to add something here to help give a barrier over their nose, then they certainly could with something like a pipe cleaner, or even a hanger or some wire that you can find in your house that you can bend, and you can sew it in here. What we love about these masks is, first of all, they are washable and they are cleanable, which gives you the ability to decrease the problem that came from the earlier study of people constantly putting on dirty masks. They're also free. You could have access to one right now. And the other thing is they're totally accessible. You don't have to go and order something online or buy something or go to a store or deplete the supply that a healthcare worker could use. A cloth mask could be sufficient for you. The biggest thing I want to tell everyone is that cloth masks are not meant to be the one-all answer. It's part of the strategy that includes three big things. Washing your hands 10 times a day. So we have 10 fingers to help us remember. 10 times a day, washing your hands can significantly cut down your ability to keep the germs on your hands, pass them to other people, or pass them to yourselves. Social distancing, keeping that distance away from each other so you don't sneeze or cough germs onto the other person. And the third is not touching your face. And there's a lot of research that suggests that masks are a big part of the third thing. You wearing a mask keeps you from touching your face. And that may be the biggest area of where we're going to get our bang for our buck. So I hope this was helpful, and I hope this helps demystify some of the confusion about masks. All of us have access to something that's cloth in our house, whether it's a winter scarf or a bandana, or some of the ones that so many wonderful people are making around the country and the world right now. I hope this was helpful. Please hang in there, everybody. We will prevail. We will overcome this virus, and you're key to being a part of the solution, which is why I wanted to come on and give some information that could help. Have a good evening, everyone, and take care.